So take a nice deep breath in here for me, all the way out, nice and loose between the shoulders. Yep, just like that. Perfect. Mike's feeling pretty good, so I'll show you what we do here in the office once that response has calmed down a little bit. So right through there. Good. Hey everybody, this is Dr. Brady, and I'm here with Mike at Kalkstein Chiropractic.
Hey everybody.
Your Towson area chiropractor. And today we're going to be talking about cervical radiculopathy. So the most common type of cervical radiculopathy that we see here in the office is cervical disc herniation or a disc bulge. So depending on the severity of your case there, what that is the annulus fibrosus here is the outer layer of the disc material. Then in the inside you have what's called the nucleus pulposus. That's that jelly-like fluid that is a shock absorber in your spine. So whether it be an acute injury like car accidents, trauma, or just degeneration, wear and tear, aging, when this annulus fibrosus gets weak, that nucleus pulposus or that jelly-like material will leak out and actually could cause cord compression on these spinal roots here. So what we do in the office after we get a history there, we do a range of motion test, and then we also do muscle strength to see the severity and the presentation of that cervical radiculopathy. So Mike, go ahead and face me here. All right. And then what I'm going to have you do is rotate your head over that right shoulder. Good. Any pain, discomfort with that? Nope. No. And then we would have him rotate to the left. So we're doing multiple planes of motion. So rotation, do extension for me. And then flexion. Good. Eating the mic there. Good. And then ear to shoulder on both sides. Yep. Good. And that Mike doesn't have a cervical radiculopathy right now, but we check all the planes of motion to see not only the severity, if there is a herniation, or what side. So depending on where the restriction is it a lateral disc herniation, is it a central disc herniation? That will all be key factors in knowing what kind of treatment plan Mike's going to go through here. So Mike, go ahead and look at me here.
All right.
What happens with cervical radiculopathies, that numbness, that tingling, kind of feels like your arm is going to sleep. Sometimes it's hard to grip things, you're losing muscle strength, and that's kind of what I want to see here. So you're going to bring your arms up like this. I'm going to apply pressure here. Don't let me win, Mike.
Sure.
Good. All the way out like this. You're going to push into my hand here, just with your arm, not really leaning your body too much. Good. And then go ahead and push into my hand here. And then in that same position, this time I'm going to pull. So if somebody had a cervical radiculopathy, a disc protrusion, this would be weak here, Mike, so let it go ahead. And then collapse. Yeah. So it could either be a muscular endurance thing where it's weak and just collapse, or just not as strong as the other side. And then here, good. And the last two tests I'll have with you is riding a Harley. Yep. And now I'm just pushing, good, and good. So I'm checking multiple levels to see which nerve root is affected. So you have C5, C6, and based on where that weakness is, I can kind of pinpoint where you're having problems there. But obviously MRI, things like that nature will confirm those testings. So Mike, go ahead and go face down here for me.
All right.
And sometimes with these cervical radiculopathies, not only are you experiencing that numbness, that radiation, possible muscle weakness, because of that injury, your body could potentially have that inflammatory response, and the muscles surrounding that area will be super tonic or tight, or the spinous processes will be tender because of that irritation to the actual tissue itself. So that's another thing I'd check here, is where you have those knots in the muscle, where it's tonic, and right there, Mike, you feel that?
Oh, yeah.
Right there, yeah.
There's one.
So take a nice deep breath in here for me, all the way out, nice and loose between the shoulders. Yep, just like that, perfect. And depending on the severity of the case, I might not adjust right away. I might lean into the modalities at first there, do some soft tissue work, that type of thing. But Mike's feeling pretty good, so I'll show you what we do here in the office once that response has calmed down a little bit. So go ahead and flip onto your back here for me.
Yep.
So right through there. Good. All right, then I'll bring you on up here, Mike. All right, just to recap the video here, causes of cervical radiculopathy could be acute trauma, could be the aging process. Over time there, the annulus fibrosis, that outer ring gets weak, the nucleus pulposus, or that jelly kind of slips out and then compresses on those spinal nerves. If you're having any of these problems where you're feeling that radiation, the muscle weakness, anything like that, stop on by in our Towson office. We'd be happy to help. I know I showed you the adjustments there. Some things we do at the office is dry needle for disc herniations. Depending on the severity of it, we might dive into spinal decompression. But yeah, we would know a lot more with the MRI there and kind of tailor a treatment plan specific to your condition. So thanks for watching, guys. If you have any questions, let me know.
Thanks, everybody.